Welcome back. A Chicago area ICU nurse is begging Americans to take COVID seriously. This video was provided by Rush University Medical Center in Chicago. It shows how the team there is having to use its lobby as COVID triage centers right now. Carol Williams is a nurse who works for that hospital system at a different location in Aurora, Illinois. She writes on Facebook this, and I quote, "Please imagine being the COVID ICU patient. The breathlessness, pain, fear, loneliness, isolation, anxiety, hopelessness, and sadness. The need to use all of your energy just to breathe. The true realization you may not get better, and facing your own mortality." That nurse, Carol Williams, is joining me now. Carol, thank you so much for joining us on this. Really appreciate it. Your words resonating with so many people across this country. I guess my first question is, how are you doing?
I'm doing good. I'm a bit overwhelmed with the amount of coverage that my post has had, and I'm so grateful that people are finding value in my words and listening, because it's the truth.
You talk in your post, as I just read, what so many of these patients struggle through. I'm struggling to breathe. You also talk about what it must be like to be that family member who is losing a loved one. You talk about your own mortality and how you've come to terms with the fact that you may actually die. And you've had that conversation with your parents and had to talk to them over FaceTime. What is the hardest part of dealing with this pandemic, as you have been for the last 10 months or so?
The hardest part is everything combined, because there's no easy part, and we are empathize with our patients and their families that they can't be there. We struggle ourselves with seeing these patients come to the ICU because they have just gotten sicker and sicker over the course of their hospitalization. So really, it's just a cumulative effect of being difficult.
I see you taking really big breaths when you're talking to me. I can only imagine what you've been through and watching so many people die in your hospital. I just finally want you to talk about the moment that you said stop. Just stop. Stop thinking this thing is like the flu. Stop thinking it's not serious. Stop thinking you may not be affected. And I'm paraphrasing here, of course, of what you said. You said it much better than I just did. What is it like to see people not following the guidelines, thinking it's not as serious as it actually is?
It's difficult to see that, and anybody that works frontline with any patients across the United States right now is feeling that as well. That's why I wrote that, because we really need to bring the reality of what's going on in our hospitals with our patients and with our staff to light, because there's so much distrust that what we're saying isn't the real deal, and it is. So I'm a real nurse, a real bedside nurse that's working in an ICU, taking care of COVID patients. And this is everything that I wrote is what is really happening in the hospital.
Carol, I thank you on behalf of this country, on behalf of the world, really, for the work that you do every single day. And I know firsthand how important the work of nurses and doctors is during this pandemic, as so many people do across this country. So thank you for putting your life at risk for us. We appreciate you. Thank you.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me, or click over on this list to see lots of other great videos.